Hello, my name is Dr. John Greenall and I'm a paediatrician and I work with the Christian Medical Fellowship. For over 70 years we've been uniting and equipping Christian doctors and now nurses and midwives to live and speak for Jesus. And many of you have been asking how we can, as a church, best support our frontline healthcare workers. And I'm going to suggest that we can understand, pray for and support them. And every day I'm hearing difficult stories from the front line. So for example, just this week, an ITU nurse told me how overwhelmed they are with numbers of patients, very sick. A doctor in A&E told me how many of his colleagues are off sick and he's having to work longer hours to cover them. A final year medical student told me her anxiety at having to start work 4 months early in a place she's never had an induction. And yet despite these difficult stories, we're also hearing some amazing stories. So that very same ITU nurse told me how in our 7 o'clock prayer slots, many of her non-Christian colleagues are stopping to pray with her for the first time. The A&E doctor told me how many of his colleagues and patients are also more open to the gospel. At CMF, we want to help you understand what is going on. And so you can listen to our Voices from the Frontline podcast, where we hear from healthcare workers on the frontline from around the world. And these prayer fuel injections can be found on our podcast feed, The First Incision, where you can also hear about a number of other issues at the interface of faith and health. We've got lots more resources on our website, cmf.org.uk, including how to speak to relatives with issues like what's the ceiling of care? How about resuscitation decisions? Let's be the church. Let's understand, pray for and support our healthcare workers. They need you just as much as you need them.